Hello everyone, my name is Kayla Hersey, and today I'm going to be performing a training workshop on improving health literacy at Brownville Memorial Hospital. After review of a patient satisfaction survey, health literacy has become an issue in language, communication, and prescription medications. This workshop is designed to address language and cultural differences and help patients to remember how and when to take their medications. Firstly, we must discuss language. Language gaps are an increasing problem in the healthcare field. In fact, 55 million U.S. citizens speak languages other than English. As part of Title IV, as well as providing good, comprehensive healthcare, it is our job to ensure that we bridge these language gaps so that our patients are receiving the best healthcare possible. Based on the results from the survey, this is an area of concern, which we are hoping to improve. One of the most effective ways to improve this language gap is by using interpreter services via telephones. These services are accurate, effective, and easily accessible to our entire staff. In addition to language, culture is also an issue when providing our best care. As reported by the U.S. Consensus, there are over 19 different cultures living in the United States. As healthcare providers and workers, we must understand that different cultures have unique experiences, values, customs, and logic. These unique qualities alter one's ability to understand the how and why of health literacy. If we are not cognizant of these cultural differences when communicating with our patients, we are not providing proper health care and therefore contributing to a negative experience when visiting our hospital. Another confounding factor of language and cultural gaps is the ability to understand prescription medication. Prescription medication is often written in an unfamiliar language to those who it is being prescribed for. In addition to an unfamiliar language, taking prescription medication involves multiple tasks, such as the how, when, and why to take it. Without proper understanding, people tend to only recognize medication based on color and shape, which can change based upon manufacturers, and therefore cause even more confusion. Now that we have identified the key areas of concern and where our hospital needs improvement, we must start with the basics. What is health literacy? While there are many different definitions of health literacy, I have compiled a definition of my own which I believe to be true. Health literacy is the ability for all parties involved, such as providers, caretakers, patients, policymakers, administrators, etc., to effectively communicate and understand health language, management, and care. Health literacy is a hot topic that's being targeted by national policies and programs. For example, a national action plan to improve health literacy has been initiated by the U.S. Department of Health and Human Services. There are 7 important goals of this plan designed to improve the overall health literacy. The U.S. Department of Health hopes to do this in partnership with organizations, professionals, policymakers, the community, individuals, stakeholders, as well as families. Specific goals of these plans include support and expand local efforts to provide adult education, English language instruction, and culturally and linguistically appropriate health information services in the community. This goal is improving public health by working towards bridging the language gap that is so greatly seen. As I said, there are 55 million people in the U.S. speaking languages other than English. Secondly, this goal is improving health literacy and public health by taking into consideration one's culture. As stated, different cultures have their own set of unique experiences, values, customs, and logic. These unique qualities can affect one's ability to understand health literacy and therefore must be considered when communicating health information. In addition, Healthy People 2020 has created goals to target social determinants of health by creating social and physical environments that promote good health for all. The organization believes there are 5 essential categories of social determinants of health, which are economic stability, education, social and community context, health and healthcare, and neighborhood environments. In order to create useful social and physical environments, people must have access to productive work environments, safe and affordable housing, proper education, and for the purpose of this training workshop, access to health care and services, and accurate health literacy. Key communication principles to consider when addressing language, culture, and prescriptions include assessing health literacy and knowing your audience. It is your responsibility as a provider to assess the health literacy of the individual you are speaking with and adapt your communication skills so that the information is understood. This also leads to knowing your audience. You must assess the language and culture of the individual you are speaking with and use methods to improve communication, such as an interpreter. This also goes hand in hand with best practices. Best practices to employ when communicating include using plain language via an interpreter, confirming understanding, and using the teach-back method. Using plain language will help the patient understand the information you are trying to convey to them. Interpreters are trained in medical vocabulary and also coached in how to maintain neutrality, adhere to confidentiality, and not impose personal views. Ways to confirm understanding include the teach-back method. This method allows the provider to confirm whether the patient understands by asking them to reiterate what was just explained. Some things to avoid during health communication include complex language or oversimplification. Complex language inhibits the understanding of the information, while oversimplification may reduce the severity of the information. For instance, when trying to have a patient understand and take their prescription, it may be important to emphasize taking the pill at the same time every day, rather than oversimplifying and using the terms like take daily. Now that we are aware of these 2 areas that patients feel dissatisfied in, we must act. In order to accomplish our goals and target our key areas of concern, we are going to participate in a workshop activity in order to improve and practice our newly learned skills. In this exercise, we will break up into groups of 3. During these exercises, 1 participant will be the patient, 1 will be the provider, and the 3rd person will observe the scenario and take notes in order to recap the situation and identify if each patient acted appropriately and addressed the key areas of concern. Results reported back to the instructor should demonstrate identification of language and cultural barriers, effective communication, proper medication consumption, and assess for understanding. Once completed, these exercises should improve language and cultural differences and help patients to remember how and when to take their medication. After we are able to improve these key areas, we hope that patient satisfaction increases and that we are contributing to improvements of health literacy at our hospital. First, break out into your groups of 3. You will be provided a pen and paper for documentation purposes, a written copy of each scenario, a cell phone to act as the interpreter phone, discharge instructions in English, Spanish, and French, and prescription bottles with instructions. In exercise 1, a patient arrives to the emergency department complaining of pain. You try to ask where the pain is and for a description, but the patient only speaks 1 language and points to their head. In exercise 2, the above patient has been treated in the emergency department, received a diagnosis, and has their discharged instructions with 3 prescriptions. For exercise 1, assign roles. Someone will act as the patient, provider, and the recorder. Once the roles are identified, use the supplies given to you in order to effectively communicate with the patient, triage the patient to the appropriate area, ensure the patient is being seen, ensure patient understands, and end with the diagnosis. Use the phone as a provided service. You can assume the patient has a diagnosis of migraines at the end of the visit. Notify the instructor when you have reached this point. Provide the instructor with the written information that was documented by the recorder, and feedback will be given to each group at the end. During exercise 2, again use the supplies in order to communicate the diagnosis you reached with the patient. Once you have reached the diagnosis, obtain the written discharge summary that is appropriate for the native language. You will be given 3 to choose from. Once you have provided the instructions, go over the information with the patient using whatever service you deem appropriate and highlight the section regarding medication. Ensure the patient understands what they are being treated for, what medication they are prescribed, how they should be taking the medication. This will ensure understandability. Notify the instructor once you have completed this task. Provide the instructor with the written information that was documented by the recorder. During these exercises, you were tasked with addressing the key areas of concern, which were language and cultural differences, and helping patients to remember how and when to take their medications. You should have been able to identify the language and cultural barriers and use the interpreter services in order to improve patient satisfaction. During the second exercise, utilization of the interpreter was also needed to teach the patient how and why they are taking the medication that was prescribed and to assure understanding. Feedback will be given to each group so that we can ensure we are performing at our best. Please feel free to ask questions. Thank you.